News 46. Local coverage you can count on.
August is here and things are getting hot at the Pahrump Nugget. Hot seat mystery basket drawings every Friday and Saturday. Just sit, pick, and win. Thursdays, win up to $1 million on the Money Vault. First 400 from 11 a.m. pull free. Where? Pahrump Nugget.
The education touchpoints are another form of self-service tool that we're providing to patients in the Pahrump Clinic that allow patients to access a wealth of information about diseases and conditions that may be of interest to them. They can access that directly using a touchscreen tool. They can print that out and take it with them. So they can also enroll in health education and wellness educational programs. There are 14 of them that the HEW department has put together, and they can actually go through that and begin or continue a previous one that they've already started. There are other forms of educational content that we're also making available where these are under development and will be in place within about 30 days.
Wonderful. This is going to be a great thing. So they need to stop by the Calvada Clinic and find out about all these things that you have access to.
Well, the check-in touch point is one of several technologies that we're using to help automate certain processes and provide additional services to our patients. Using the check-in touch point, a patient can avoid standing in line when they're arriving for their appointment. And what the process that we use is really the same process that would be used by the person at the front desk when a new patient arrives or when a patient arrives for their appointment. The first step in that process is for them to identify themselves, because we have to know who they are. And they can identify themselves using a priority access card that our senior Dimensions patients may have. They can identify themselves using a driver's license, and all of these have a two-dimensional code on them that we can scan. And the third way that they can identify themselves directly is with the insurance card itself, and on the back again there's a two-dimensional barcode. Now these barcodes are very easy to scan. There's a scanner that is built into the touch point, and if you heard that beep says that the scan was successful, and it immediately knows who I am. Once it knows who I am, it can look up the appointment, present that to the screen. The patient then says, yes, this is the appointment, this is why I'm here. And the rest of the process then mimics the same check-in process that the front desk staff use. In a nutshell, that is, they would confirm their demographic information like their name and address and phone number. Then they would sign a consent form using the signature capture pad, which is also here. Once the signature has been captured on the consent form, then the system calculates their copay. There may not be a copay, but if there is one, then the patient is prompted to make that payment with a credit card or a debit card. When they've done so, it prints a receipt, and they're done. They can immediately take a seat in the waiting room. Now, there is one more way that a patient can also use this system. If they use the SMA portal to schedule their appointment and to make their payment online using the web, the last step in that process is to print out a confirmation sheet. And on that confirmation sheet is a barcode that allows them to circumvent this entire process. When they come into the clinic, they can walk right up to this machine. They don't even have to touch the screen. They just scan that barcode, and they're done.